Implementation of welfare schemes, welfare of differently abled persons. 2.31 Introduction. The Department for Welfare of the Differently Abled Persons implements various welfare schemes for the differently abled person to empower them and remove barriers in terms of communication, economic, institutional, social or structural factors. There are 22 government schools, 50 government aided schools, 119 government-run rehabilitation homes and other homes, 95 early intervention centers, and a 16-day CAG center functioning under the aegis of the Department for the Welfare of DAPs. 2.3.2 Organization chart. The Secretary to Government, Department for Welfare of Differently Abled Person is the overall head at the government level. The field formation of the department is headed by the Commissioner of Welfare of Differently Abled Persons, Commissioner. The organizational chart of the department is given in Appendix 2.12. 2.3.3 Statistics of Differently Abled Persons. As of 31st March 2022, a total of 14.34 lakh persons were identified as differently abled and National Disability Identity Certificate (NDIC) were issued. Out of this, 7.07 lakh persons were locomotor disabled, 1.12 lakh were visually impaired, 1.97 lakh were hearing impaired, 3.25 lakh were intellectually disabled, and 0.93 lakh had other disabilities. The district-wise percentage of persons with disabilities are depicted in Exhibit 2.14. Exhibit 2.14 Geographical spread of differently abled persons in Tamil Nadu. Top அது drawing கொடுத்துருக்காங்க. அதில் வந்துட்டு top 5 districts. Vellore 6.6%, Kanjipuram 5.1%, Thiruvannamalai 4.8%, Trichy 4.6%, Chennai 4.6%. 2.3.4 Audit Objectives. The objective of audit were to assess whether planning for implementation of the schemes was proper, whether adequate funds were provided on time for implementation of the schemes and utilized as per scheme guidelines, whether the schemes were implemented in an efficient, effective and economical manner and monitored properly. 2.3.5 Audit Criteria. The criteria adopted to arrive at the audit conclusion were the Rights of Persons with Disabilities Act 2016 and Rules 2017, the Tamil Nadu Rights of Persons with Disabilities Rule 2018, the Rehabilitation Council of India Act 1992, the National Trust Act 1999, National Policy for Persons with Disabilities 2006, Tamil Nadu Tender Transparency Act, the Tamil Nadu Welfare Board for the Disabled Person Act 2007 and Rules 2008, orders, circulars, guidelines issued by the Government of India and Government of Tamil Nadu from time to time. Audit Report, Compliance Audit, Tamil Nadu for the year ended March 2022 is the heading. So 2.3.6 Audit Coverage and Methodology. The audit covering the period from 2019 to 22 was conducted during July to September 2022. 38 districts were stratified into 4 zones and 1 district was selected from each zone through stratified random sampling. In addition, Chennai district, being the capital, was also selected. Out of 77 schools and other institutions in the 5 sample districts, 29 were selected. Appendix 2.13 within bracket, randomly at the rate of 25% from each category of institution. 5 schemes, namely 1 maintenance allowance, 2 grants to homes and special schools, 3 assistive devices, 4 scholarships and 4 marriage assistants were selected for scrutiny based on the quantum of expenditure incurred during 2019 to 22. An entry conference was held on 23rd August 2022 with the Principal Secretary to Government, Department for the Welfare of Differently Abled Persons, and audit objectives, criteria, and audit coverage were discussed. Records of the Secretariat Commissionerate sample District Differently Abled Welfare Officers DDAWOS selected government special schools and government aided special schools, government and NGO run homes, and early intervention centers in the sample districts were test checked. The field work also included joint physical inspection, collection of documentary and photographic evidence, and beneficiary survey. An exit conference was held on 28 December 2022 with the Secretary to Government, Welfare of Differently Abled Persons Department, and the Commissioner to discuss the audit findings. The responses of the department were considered while drafting this report. 2.3.7 Acknowledgement. Audit acknowledges the cooperation and assistance extended by the department and audited entries in conduct of this compliance audit. 2.3.8 Planning. Non-formulation of a state policy. According to Section 66 of the Rights of Persons with Disabilities Act, RPWD Act 2016, and the rules framed thereunder, within bracket the Tamil Nadu Rights of Persons with Disability Rules, TNRPWD Rules 2018, the state government should constitute a state advisory board SAB with experts in the field. Further, as per Section 70 of RPWD Act, the SAB should meet at least once in every 6 months and advise the state government on policies, programs, legislation, and projects with respect to disability. As per the provisions contained in Section 71 within bracket 2B of RPWD Act 2016, SAB was required to develop a state policy to address issues concerning persons with disabilities. Though SAB was constituted in 2017, only 3 meetings were held till March 2022. Even 6 years after enactment of the RPWD Act 2016, GO Tamil Nadu had not framed the state policy to address the issues of DAPs. The formulation of a state policy was not discussed in any of the SAB meetings according to the minutes of these meetings. Government replied within bracket January 2023 that the state had a policy right from December 1994, but a revised policy was to be framed based on the RPWD Act 2016, and efforts were made by calling within bracket August 2022 for public opinions for framing the policy. Audit observed that the department was functioning without a clear policy in line with RPWD Act 2016. The Act, which has its genesis in the United Nations Convention on Right of Persons with Disability, has a right-based approach in the welfare measures for DAPs, which needs to be reflected in the policies. Lack of an updated policy was one of the reasons for deficient implementation of schemes, as discussed in the subsequent paragraphs. Non-conduct of survey and non-maintenance of database. The National Policy for Persons with Disabilities 2006 mandates regular collection, compilation, and analysis of data relating to socio-economic conditions of persons with disabilities and to maintain a centralized database of beneficiaries. Also, the RPWD Act 2016 envisages that a survey of school-going children to be conducted and updated every 2 years to identify children with disabilities. However, it was observed that survey was not conducted till date, November 22, to identify the total number of persons with disabilities in the state and the number of school-going children with disabilities. The department is also issuing National Disability Identity Certificate cards since 1989 after assessment of the extent of disability by specified doctors. Till March 2022, 14,34,837 NDIC cards were issued in decentralized manner by the district officers. However, these details have not been consolidated into centralized database. In the sample district, the records were maintained in manual registers. Scrutiny of records also revealed that the manual data held in the district offices in a disaggregated manner has not been consolidated, and the department needs to take efforts to maintain a centralized database of persons with disabilities so that there is proper and effective targeting and delivery of schemes benefits. Lack of state policy, non-conduct of regular SAB meetings, and non-aggression of manual data did not help in effective planning and resulted in deficiencies in implementation of welfare schemes as discussed in the succeeding paragraphs. 2.3.9 Financial Management, Budget and Expenditure. The budget provision and expenditure incurred by the Department of Welfare of the DAPs during the period covered by audit is detailed in Table 2.15. Table 2.15 Budget and Expenditure Details. Year. Budget Provision Expenditure. Year 2019-20 630.20 rupees in crores. So 630.20 crores. Expenditure 595.88 crores. 2020-21 698.80 crores. Budget. Expenditure 617.75 crores. 2021-22 820.09 crores budget. Expenditure 720.01 expenditure. Total 2149.09 budget provisions and 1933.64 as expenditure. The department utilized about 90% of the budget allocation. As commented in paragraph 2.3.10.4, savings under several heads were not utilized for paying scholarships and assistance to students by reappropriation. Deficient management of the state fund for DAPs. RPWD Act 2016 envisages creation of a state fund for DAP fund. The Act empowered the state government to frame rules regarding various provisions of the Act, including the fund. Accordingly, GOTN framed rules in July 2018. As per the rule, the fund could be used for providing financial assistance for DAPs and implementing schemes to further the purposes of the Act. Next, administrative and other expenses. Such other expenses as may be decided by the government body. The fund was to be admitted by a governing body headed by the Secretary to Government of the department. The fund was to be created by the contribution from the government as well as donation from the public and corporates and invested. In July 2018, GOTN sanctioned rupees 10 crore for creation of the state fund for DAPs. The money was drawn and deposited in a reserve fund and public accounts of GOTN. Expenditure totaling of rupees 2.72 crore incurred during 2019-22 was initially booked under regular budget heads of the department and subsequently met as expenditure under the reserve fund. As of March 2022, an amount of rupees 7.28 crore was available in the reserve fund. During the exit conference, the Commissioner informed that the fund could not be utilized due to COVID-19 and a lack of clarity on utilization. Audit observed that the RPWD Act 2016 provided for creation of the state fund and investing it in interest-bearing deposits and to be administered separately by a designated governing body. GOTN, however, invested the fund in non-interest being reserve fund deposit, which was not in order. Further, no effort was made to mobilize funds through public or corporate donations. Thus, objective of creation of the fund was not achieved as the expenditure was still incurred through budget rather than by the governing body with more financial freedom. Implementation of welfare schemes. The department is implementing about 70 welfare schemes. The department has been issuing National Disability Identity Certificate (NDIC) cards to DAPs to aid them to avail benefits under the various schemes implemented by the government through the District Differently Abled Welfare Office (DDAWO). NDIC cards were issued to DAPs after an assessment of their conditions by specified doctors and based on the extent of disability. The major schemes which constituted 86% of the total expenditure during 2019-22 were taken up for analysis. The provision of funds vice versa. The expenditure incurred on these schemes during the audit period is given in Table 2.16. Table 2.16 details of provisions of fund and expenditure incurred during the period 2019 to 22 on selected schemes. Heading Welfare Scheme, provision of funds in crores, number of beneficiaries, expenditure incurred in crores. Maintenance allowance, provision of funds 1094.59 crores. Number of beneficiaries 2,13,047. Expenditure incurred 1093.11 in crores. Grants to homes and special schools 351.48 provision of funds, and 302 beneficiaries 347.73 expenditure incurred. Assistive devices 96.14 provision, 67,609 number of beneficiaries, 96.16 is expenditure. Scholarships 23.37 as a provision, 60,617 beneficiaries, 22.29 expenditure. Marriage assistance 15.22 in crores provision, 1,682 as a beneficiaries, 15.15 in crores as expenditure. Total expenditure is 1,574.44 in crores. Source: data furnished by Commissionerate and Appropriation Accounts. Audit observation on implementation of the above schemes are brought out in the succeeding paragraphs. Maintenance allowance. GOTN is providing maintenance allowance at the rate of 1,500 per month to 5 categories of disability. 1. Intellectually disabled person. 2. Muscular dystrophy. 3. Persons affected with Parkinson's disease, spinal cord injury, and multiple sclerosis. 4. Leprosy affected persons with a disability of 40% and above. 5. Severely disabled person with a locomotor disability of 75% and above. Beneficiaries were approved based on the applications received at DDDA-WOS enclosing their NDIC card. A remark போட்டிருக்காங்க, revised to 2,000 rupees per month from January 2022. Audit report compliance. Audit Tamil Nadu for the year ended March 2022. Family card and bank details. The allowance is the continuation. Beneficiaries were approved based on the applications received at DDA-WO office enclosing their NDIC card, family card, and bank details. The allowance is directly credited to the bank account of the beneficiaries. As per the extant procedure, applications for grant of maintenance allowance received during the year are consolidated during the month of February and September and kept on a waiting list. A separate proposal for the sanction of funds for these waitlisted beneficiaries is sent to the government by the Commissioner, and disbursement starts after sanction by government. During 2019 to 22, GOTN incurred 1,093.11 crore towards maintenance allowance. Observations noticed in the dispersal of maintenance allowance are discussed below. A. Non-sanction of maintenance allowance to the waitlisted DAPs. As per the procedures followed by the department up to September 2021, the waitlisted beneficiaries were granted maintenance allowance right from the month of consultation of their application, namely February or September. However, the sanction orders issued from September 21 indicated release of funds for disbursement from the date of issue of the sanction order. Instances of delays in sanction and consequent denial of benefit of maintenance allowance for the period of delay noticed by audit are given in Table 1.7. Table 2.17 waitlisted beneficiaries granted maintenance allowance. Disability category: consolidation month, date of proposal by Commissioner, date of government order, delay in months, number of waitlisted beneficiaries, and amount denied to beneficiaries in crore. 1. Leprosy affected persons. September 2019, February 2020, September 2020, February 2021, and September 2021. Date of proposal by Commissioner 27th August 2021. Date of Government Order 4th October 2021. Delay in months 1 to 25 months. The number of waitlisted beneficiaries 2089. Amount denied for beneficiaries 4.38 crores. Number 2. Intellectually disabled and severely disabled. September 2021 is the consultation. Proposal by Commissioner 16th December 2021. Government Order 25th February 2022. Months delayed. Period delayed 6 months. And number of waitlisted beneficiaries 4053. Then amount denied to beneficiary 3.65 crore. 3. Persons affected with muscular dystrophy. February 2020, September 2020, February 2021. 28th May 2021. This is a proposal from Commissioner, and Government Order 20th September 2021. Delayed in months 8 to 20. Beneficiary 318. 0.63 crores. 4. Persons affected with Parkinson's disease, spinal cord injury, and multiple sclerosis. September 2021. Provision 29th December 2021. Government Order 31st March 2022. Beneficiary delay 7 months, and beneficiary 144. Amount 0.15 crore. Source records of Commissionerate. As seen from the above, the delay in forwarding a proposal for sanction of funds by the Commissioner ranged 1 to 25 months, resulting in consequent delay in issuance of sanction orders. The change in instruction to release the funds to the beneficiaries from the date of issue of sanction orders had resulted in denial of benefits of 8.81 crores to 8.81 crore to 6,604 beneficiaries. Government attributed January 2023 the outbreak of COVID-19 for the delay in consultation of application by the Commissioner. Audit observed that cases predating the pandemic were also delayed, and considering the fact that the government machinery was functioning albeit with lesser manpower, the abnormal delay which ultimately impacted the DAPs was avoidable. B. Delay in sanction of personal assistance allowance. In addition to maintenance allowance, GOTN is providing a personal assistance allowance PAA of ₹1,000 per month to DAPs who are in need of high support and require an assistant to fulfill their needs. The scheme commenced in October 2019. The eligibility of DAPs who apply for PAA is assessed by an assessment board established in each district, and the list is submitted Commissioner every year. The number of DAPs identified for sanction of PAA during the period covered by audit are given in Table 2.18. Table 2.18 year-wise details of persons identified for disbursement of personal assistance allowance. Year 2019-20, number of beneficiaries 1,656. 2021 757, 2021 to 22 2466. On a scrutiny of records, audit observed that though 1656 GAPs were identified during 2019-20, PAA was sanctioned only for 800 GAPs during this period. The reasons for non-sanction of PAA to the remaining 856 GAPs were not on record. GOTN sanctioned October 2019 48 lakh for this purpose. However, it was noticed that due to procedural delays, the disbursement started only in January 2020, leading to surrender of rupees 24 lakh. The remaining 856 identified beneficiaries were granted PAA only from September 2021 after a delay of 23 months, though they were eligible from October 2019. Similarly, 757 persons identified during the year 2021 were granted PAA from September 2022 after a delay of 29 months. For the year 21-22, in respect of 2,466 beneficiaries, the Commissioner sent the proposal to government only in September 22, and government orders were awaited November 22. The details of proposal, sanction and disperse of PAA are given in Table 219. Table 219, details of delay in payment. Year 1920, first batch. Proposal 6 August 2019. Date of GO 24th October 2019. Eligible from October 2019. Proposal assistance allowance granted from January 2020. Denied benefits 3 months. Number of waitlisted beneficiary 800. Amount denied to beneficiaries in crores 0.24. 2019 and 20, second batch. 10th June 2020 is the proposal date, and government order 8th December 2021, and eligible from October 2019. Personal assistance allowance granted from September 21. Denied benefits 23 months. Number of waitlisted beneficiaries 856. Amount 1.97 crores. Year 2021 up to July 21. 31st August proposal. Government order 26 August 2022. Proposal 31st August 2021. Order 26 August 2022. Period from April 20. Grant eligible from April 2020. Allowance granted from September 22. And then denied benefits 29 months. The number of waitlisted benefits 757. Amount 2.2 crores. Total 2,413 beneficiaries 4.41 crores. Thus, the delay in submission of proposal or abnormal delay in issuance of government order had resulted in denial of benefits to the tune of 4.41 crore to 2,413 beneficiaries. Government stated January 23 that difficulties in constitution of an expert assessment board at district level to identify eligible beneficiaries and difficulty in organizing assessment camps due to election code of conduct in December 2019 and COVID-19 from March 20 were the reasons for the delay. Audit, however, observed that there were a significant delay at government level even after the proposals were submitted by Commissioner. The delay of 1 year in respect of proposals submitted by Commissioner in August 2021 was avoidable. Recommendation 1. Responsibility should be fixed for the delay in forwarding the proposal and streamline the system for sanction of maintenance personal assistance allowance to ensure the benefits of government scheme reach the eligible beneficiaries.